I got a question about the talking points thing you handed out here. Is what in the healthcare reform bill is going to do for me? No more copays. There's going to be no more copays or deductibles. Okay, no more rate increases for pre-existing conditions, gender, occupation.
Well, no more copays or deductibles for preventative care.
Preventive care.
Yeah.
Okay, but annual cap on out-of-pocket expenses. Okay, group rate for national pool, guaranteed affordable oral hearing and vision care for your kids. Get to keep your doctor. And they're going to cover mental health, but no more coverage.
Mental health coverage is by law now because it's expanded the last few years.
No more coverage denials for pre-existing conditions. No more lifetime limits on how much insurance companies will pay. And my question is how does this, with what I'm looking at here, and an insurance company has to abide by this, how do they stay in business if you cap everything we have to pay them, but you don't cap anything that they have to provide for us? Well, and therefore, if that's the case, how do we not end up on the public plan?
What this does, in fact, the insurance industry agreed about a month ago, because it's in the bill, that they would no longer do pre-existing condition or rate you based on your illness, because the whole point, the tradition of insurance is to spread the risk. You know, not everybody, thank goodness, is going to have heart trouble. Not everybody is going to have cancer, but if all of us pay into the system, they spread it. Insurance companies being profit making are going to, they need to, if you're sick, they're going to charge you a whole lot more if you have high blood pressure than they do somebody who's not. I know, not under this, but they agreed to do that. They agreed that in whatever health care bill on the private sector, they would do that. So, you know, and this is, you know, I wasn't in this meeting, but that's what they announced.
But how can they afford to stay there? We're there. Let's go. If they can't charge anybody any more money, is basically what this is coming down to. But yet, they have to pay out everything that everybody wants. And then once they're gone, how is the government going to be able to do that on the federal plan? There's no way that can be done. This is just, I mean, no offense, but how stupid do you think that we all are? And I'm going off what you handed me.
Okay, that's a summary of some of the good things in the bill that people have complained about for many years, including a cap. I've had many people who have $1 million cap, and someone who has a long-term illness, particularly if it's cancer, you know, they have hit that cap, and I've had a number of them in our own district. So we're trying to provide, if you're going to get into the private sector, you know, there's no cap on Medicare. Of course, Medicare doesn't kick in until you're 65. There's a lot of reasons on Medicare issues, but the goal of the bill is to shore up private sector insurance and reform it to make sure it can still serve the purpose, but also is a fail-safe, have a public plan, have a co-op plan first, and a public plan if that doesn't work.
All insurance companies out of business. And the government plan of how to put insurance companies
I cannot imagine that, because
this would be that.
Well,
that's why you're passing it. I mean, here's my thing. Government, you're talking about private ownership, but yet the government telling, or you're talking about private ownership of companies, but you want the government to tell them how to run those companies. How to run them out of business. Isn't that fascism? The definition of fascism?
You have private sector insurance and has a single payer plan. If you go to Norway, if you go to lots of countries,
single payer. So you are in favor of single payer.
Okay.
Mr. Green, you are in favor of single payer.
We only have about an hour to do this, and I apologize.
He just said he's in favor of single payer.
Go to our website. Well,
didn't he?
And Obama wants you want to hear me comment. But you can go to our website and contact us. Those of you who have know that we respond to it, and we will get you information. But, you know, and we do have a lot of town hall meetings. But again, the best way to do it is to come and we can talk reasonably instead of having a cheering section one way or the other.
That's what we need.
But thank you for being here.
Go the Norway out.